me start my video. Um, well, I can introduce myself. I'm Mars Aponte Rosales. I am the Communications Associate at ASAN. And today we are going to be talking about COVID-19 and Mpox and ways we can reduce the spread of these diseases in our communities. We can go to the next slide. So we're going to first start talking about what is Mpox. So Mpox is a contagious viral disease. Symptoms of Mpox include a rash that looks like pimples or blisters that typically appear on hands, feet, mouth, face, chest, or genitals. And this can also come along with flu-like symptoms such as fever, headache, body ache, tiredness, and swelling of the lymph nodes, like on the sides of your neck. Some people with Mpox only get a virus or only get a rash, while others may have the flu-like symptoms as well. I didn't put a picture in the slide in case people don't want to see them, but in case you want to see what Mpox rashes look like so you can recognize them, I am posting a link in the chat. And so Mpox spreads from person to person, typically through direct contact with someone who has the virus. And people can be contagious with the virus from before symptoms start through up to like a month or whenever the rash is persisting. Direct contact can occur by touching someone's Mpox rash or by interacting with someone's bodily fluids, such as saliva. So that means that spread can occur through things like skin-to-skin contact, kissing, sex, including oral, anal, vaginal, or touching of genitals. It also can occur in prolonged face-to-face contact, like having a long conversation in close proximity, face-to-face. And even though it's less likely, Mpox can also spread through the touching of surfaces or objects, meaning like if someone has Mpox and touches a counter and someone else were to touch the counter directly after them, it could transmit that way. And it has previously transmitted through animal to human transmission. And again, Mpox can spread before the symptoms appear in a person. Next slide. So who is most impacted by Mpox? The fact is that anyone can be infected with Mpox if you're exposed to it. But in the past few years, Mpox has disproportionately affected LGBTQ folks, specifically mostly men who have sex with men and trans and non-binary people. It also has affected a lot of Black, Indigenous, and people of color. This is likely due to spread occurring in groups that gather and spread time in close contact together. As for like who is at a higher risk of getting severely sick or with Mpox, it's immunocompromised people, pregnant people, and elderly people are at a higher risk of severe Mpox. Next slide. So what should you do if you think you might have Mpox? You should go to your doctor or an urgent care center. There is a test for Mpox that involves like taking a swab to the rash. They can tell you if it's positive or negative from that. If it is positive, keep talking to your doctor. They may prescribe antivirals for those who are higher risk of severe outcomes. And in general, your doctor should be able to advise you on what to do. You should isolate from others as much as possible because, again, Mpox is contagious, and once you know you have it, you should try to avoid spreading it as much as you can. Try not to touch or irritate your rashes. You should keep them covered with bandages or clean clothing. And another important thing to do is to tell folks that you've been in contact with that you have Mpox, including over the few days before you tested positive. This is so that other people can monitor themselves and get tested if they need to avoid continuing spreading Mpox. Okay, next slide. So how can we protect ourselves and each other from Mpox? An important thing is to learn to recognize the signs and symptoms of Mpox. Like, just attending this webinar is a great tool because all of us who are learning this information can recognize it and be able to stop the spread if we were to encounter it with someone or ourselves. That way we know how to get tested and isolate if you develop a rash that might be Mpox. You should also talk to your partners and people you spend close proximity to. Make sure everyone understands how to recognize the signs of Mpox. And if you have to interact with someone who has Mpox, like if you're caretaking for someone, use PPE, personal protective equipment, such as gloves and masks. And then once you're done interacting with them, like once you've left the room, make sure you discard your PPE and wash your hands. Next slide. There is also a vaccine for Mpox. So you can check with your doctor or your local health department to determine if you're eligible. There's different eligibility requirements depending on your local area. Potential eligibility requirements, like common ones, are things such as a known or suspected Mpox exposure. So you can actually get the vaccine for Mpox either before or after exposure, and it should reduce the severity of an infection or prevent infection. Other common eligibility requirements include men who have sex with men, who have more than one sex partner, or have recently been diagnosed with an STI, a sexually transmitted infection, or trans or non-binary people who have more than one sex partner, or have a recent diagnosis of an STI. Other factors include people who've had sex somewhere in public in the last 6 months, or workers who may have been exposed, like healthcare workers or laboratory workers. The vaccine is two doses that are taken 4 weeks apart. And again, they can be given before or after exposure to prevent infection or reduce severity. So definitely talk to your doctor about if you're eligible for this. I think this is the end of the slides on Mpox. So if anyone has any questions or comments, of course, we'll keep taking questions as we continue the presentation, but we're going to transition into talking about COVID-19 after this. So I'll pause for a second and see if anyone has any questions, and you can type it into the chat. To keep typing them in the chat, and we'll pause throughout, but we can continue on to talking about COVID-19. So COVID-19 is a contagious viral disease that can cause severe illness and death. SARS-CoV-2 is the virus that causes COVID-19, and it continues to mutate and spread widely. Symptoms can include things like flu-like symptoms, fever, headache, body aches, tiredness, cough, sore throat, and nausea. It also can include GI symptoms like diarrhea or vomiting. Loss of smell or taste can happen. And this is not a complete list at all. COVID-19 can have many different symptoms or no symptoms at all. Next slide. How does COVID-19 spread? So COVID-19 is highly contagious and spreads through the air. So it can spread through droplets and particles that an infected person breathes out. Virus particles can live in the air for many hours, so spread can occur even after an infected person has left the room. And COVID can also spread asymptomatically, meaning if someone is infected with COVID but never develops any symptoms, they can still spread COVID. And it can also spread pre-symptomatically, meaning in the few days before someone develops symptoms, they can still be contagious, like we talked about with Mpox as well. Next slide. Okay, but isn't COVID-19 over? We've heard about, different things about whether or not the pandemic is still happening, whether or not COVID's still a big deal. Last year in May of 2023, the US ended the public health emergency of COVID-19. But that doesn't mean that COVID has stopped spreading. COVID still kills, hospitalizes, and causes new disabilities and chronic illnesses in people. Unfortunately, because the public health emergency has ended, we actually have fewer ways of seeing how prevalent COVID-19 spread is. So there were things like cases and hospitalizations that had to be reported by the states to the CDC. But unfortunately, a lot of the measurements have gone away or become much less accurate. In general, there is much less testing of COVID. So it's really impossible to know how many cases there are at a given time anymore. One tool that we still do have is wastewater, which is basically when someone is infected with COVID-19, they shed viral particles through like fecal matter, through poop. And that in a lot of places is collected into the sewer system and goes to wastewater plants, which is basically then you can measure how much COVID is in an area at a given time. Next slide.
We have something in the chat from Deshay Pony. They said wastewater testing is also used for Mpox tracking.
Yes, that is correct. There are good ways of, wastewater is really helpful at looking at a lot of different diseases. I think flu and RSV are also available to see wastewater tracking. I just want to show a few examples of wastewater data that are available online. This slide shows the CDC wastewater data. So this is from a few weeks ago. So this was during January when I screenshotted these. But it showed the current, on the left, you see a map with the current wastewater levels. The darker blue levels indicate high or very high levels of COVID in the wastewater. And the light green indicates lower levels, whereas the states that are in gray, they don't have enough data to make an assessment on. So as you can see, a few weeks ago, the wastewater was very high throughout the United States. And on the right, you can sort of see a trending graph as to like the amount of COVID in the wastewater and a little bit of geographical analysis. And this goes back up to a year. And this is available on the CDC website. Next slide. So there's another website that I feel like is really good for looking at wastewater. It's called BioBot, and it gets a lot of the same data that the CDC has, but I appreciate that it goes through the entire pandemic. So as you can see on the graph on the left, you can actually see data through 2020 when wastewater first started to indicate COVID-19. And so you can sort of see where we're at in comparison to previous years as well, which I think is really helpful. Another thing that I like about the BioBot website is for a lot of places, if you scroll down on the website, you'll see what is on the right, which is local areas. So you can put in your state and see if your county is included in this data and sort of see how the wastewater is doing in your area, which I think is really helpful. Next slide. So we're also going to talk a little bit about long COVID. Long COVID is also known as long haul COVID, post-acute COVID-19, post-acute sequelae SARS-CoV-2, or just like the long-term effects of COVID or chronic COVID. Basically, all of those terms just mean the continuation or development of symptoms or conditions after an acute COVID infection. So say you were infected with COVID in November. If either one of those symptoms never left, like if you kept having a cough that never went away after your infection, that can be a form of long COVID. Or if, say, you were infected in November and you got over it, you felt better, but a month later you started developing new symptoms, that is also considered long COVID. And symptoms of long COVID can include things like fatigue and post-exertional malaise, which is basically when like a day or so after exerting yourself mentally or physically in a way that you used to be able to do, your body just kind of shuts down and isn't able to continue doing the same level of activity. Other symptoms include coughing, chest pain, stomach pain, headaches, brain fog, tachycardia, which is when your heart beats really fast, pain in muscles or joints, trouble sleeping, feeling dizzy or lightheaded when you stand, mood changes, And this is not an exhaustive list. There's a lot of things that basically can come up with long COVID. Next slide. And Dean in the chat also posted ASAN's long COVID resource, which is available in English and Spanish and easy read and plain language. So more about long COVID. Mild and asymptomatic cases can develop long COVID. So just because COVID felt like a cold to you, or just because it was mild, or you didn't even have any symptoms, it doesn't mean that you can't develop long COVID. Unfortunately, there is currently no cure, just treatment. There's treatment options for various symptoms that, range in how effective they are for each person. So there are ways that might reduce likelihood of long COVID. Things like getting the vaccine, which we'll talk about in a few slides. Getting the vaccine yearly, staying up on it, can reduce your chances of getting long COVID. There's some evidence that taking Paxlovid, which is an antiviral, might reduce the chances of long COVID. And a lot of folks are saying that rest might reduce the likelihood. But unfortunately, even if you did all the right things, anyone who's infected with COVID-19 can develop long COVID. So the only way to fully prevent it is to, prevent being infected. There's also to note, there's other post-COVID-19 complications. So after a COVID infection, you are at an increased risk of a heart attack or stroke. There's also a higher risk of developing autoimmune conditions and things like POTS and other conditions.
And just wanted to flag Sarah Lasberg shared in the chat a great example to share with people who don't think long COVID is an issue or, quote, only affects people who are sick anyway because we don't count. Physics girl was young, very healthy, and is currently bedridden with long COVID. And then Sarah shared a YouTube link in the chat that they posted.
Yeah, thank you so much for sharing that, Sarah. It really is something that can affect anyone. And, every time you get a COVID infection, there is a risk of developing long COVID. So it's really important that we continue to talk about it and talk about how we can reduce the spread of COVID. Okay, we can move on to the next slide. So who is most impacted by COVID-19? As with Mpox, some similar things come up, like elderly people, immunocompromised people, and pregnant people. People with other health conditions are more likely to be impacted by COVID-19. So the CDC list of people who might be higher risk includes a lot of health conditions that are very common. And so like it includes things like asthma, cancer, diabetes, heart conditions, and many more. And the CDC list also includes people with disabilities and mental health conditions, which includes and is not limited to things like autism, ADHD, depression, deafness and hearing loss, cognitive impairment, mobility disabilities, and more. So I think it's really important why ASAN is still talking about COVID-19 is that like this does affect us and our communities, just like autistic people and disabled people as a whole are more likely to be impacted by COVID. Other demographic considerations, there's evidence that BIPOC, like Black, Indigenous, and people of color are more impacted by COVID, as well as LGBTQ people. Particularly, I've seen studies that bisexual folks and trans folks are more likely to be impacted by long COVID. So I think we can go to the next slide. What should you do if you are infected with COVID-19? You should call or set up a virtual appointment with your doctor. Your doctor might prescribe Paxlovid, which is an antiviral medication if you're eligible for it. If you want to take Paxlovid, you have to start taking it within the first 5 days of your infection. So it's really important to try to proactively reach out to your doctor once you test positive or think you have COVID. And if you don't have a doctor or access to a doctor, there's the Test to Treat program in the US, which can help you access free virtual care. It's at testtotreat.org. You basically can get set up with a virtual consultation where they may be able to prescribe you Paxlovid if you're eligible for it. You should isolate from others as much as possible until you are no longer contagious. And if you have to interact with others or leave your house while you are still contagious, please wear a well-fitting mask or respirator. I don't know if in the news there is talk of the CDC lowering isolation guidelines in the near future, which is unfortunate, but the reality is that if you are still testing positive on a rapid test, you are still contagious. And so please, if you are able to keep others safe and isolate during an infection, that is better for everybody. And again, like with Mpox, tell people you've been in contact with that you have COVID-19 so that they can isolate and test and seek care if they need to. You should keep monitoring your symptoms and again, talk to your doctor if you need to come to the hospital or have more care in some way. And then definitely rest. As we talked about with long COVID, resting might help reduce your chances of long COVID or just help you get better faster from your acute infection. Resting is really important for your immune system.
In the chat, we have Ocean saying we need paid leave to better address the need for isolation. And Sarah says yes in all caps.
Definitely. Yeah, no, it's really unfortunate that, most people aren't able to isolate fully if they need to work and don't have paid leave at their workplaces, because then that just means that they are likely exposing their coworkers and not being able to rest fully themselves. So we can go to the next slide. And we can talk a little more about how can we protect ourselves and each other from COVID. So masks work well to reduce the spread of COVID, specifically well-fitting respirators such as N95s, KN95s, and KF94s. So on the screen, I have some examples. The two white ones on the left are examples of N95s, which is the US certified respirator. Yeah, basically they have over the head strap and they should be able to, fit well in order to block out viruses. The black one closest to the middle is a KN95, which is a Chinese version of a respirator. They typically have ear loops, which can, reduce the quality of the fit, but depends on the person's face, obviously. And the one on the far right is a KF94, which is the Korean certified respirator. So basically, you should, if you're able to, try out different types of masks and see what works for you, because different people's faces fit differently. For me, I actually really like the Gerson mask on the far left because I find it really breathable and it doesn't touch my nose or like bother my face in other ways. And I also want to point out that you should make sure to get masks from like reputable sellers. Unfortunately, there are like some, masks or respirators available on Amazon that are, counterfeit or not legit. One resource I want to shout out, unfortunately, it doesn't do what it used to do, but projectn95.org. It used to provide free respirators to people who needed them and sell them as well. It has shut down in the recent months, but it still has information on where you can buy different types of respirators that are like from sellers that are trustworthy. So if you, I think, yeah, so you should check that out. Dean just posted the link. Thank you.
Yeah, also in the chat, Ocean said, thank you for calling. They said, thank you for calling our respirators instead of just masks, but they might have meant thank you for calling out respirators instead of just masks.
Yeah, thank you, Ocean, for that. Yeah, it's really important. Obviously, earlier in the pandemic, we didn't all, there wasn't as much access to respirators, and, we were all using what we could get our hands on, which was like things like cloth masks and surgical masks, which are definitely better than nothing, but certainly do not protect yourself or others in the same way that that respirators do. Okay, next slide. So another important way we can protect ourselves and each other from COVID is air filtration and ventilation. So filtration refers to cleaning the air, which includes things like HEPA air purifiers. So the picture on the top right shows different air purifiers that have filters within them that can filter out things like viruses. Another tool that is in most buildings is your HVAC system, like heating and cool and AC. If you make sure that the filter in it is changed out regularly, and when it runs, it cleans through the air as well. So you can actually, set your AC to be on fan mode, like where it doesn't actually heat or cool, but just circulates the air, which can help filter out viruses. Another tool that is really useful and often more accessible to people is this Corsi Rosenthal boxes, which are basically do-it-yourself air purifiers. People invented them out of a need for air filtration without being able to spend money on the machines that were on the market already. And so the picture in the bottom right is an example of one. Basically, it is air filters taped into a box with a fan that pulls the air through it, filtering from all sides, essentially. The picture there has like PC, like computer fans. And so they actually work really quietly and effectively. Other people have made them with box fans or other types of fans. If you look online, there's a lot of resources for how to make them, or there's places that sell, like some of the parts in order to make them easily yourself. They work for a really long time and like can clean the air faster than even some of the store-bought HEPA filters. Another thing that's really important is ventilation. So filtration is cleaning the air, ventilation is adding in fresh, uninfected air. So things that would be improving ventilation are opening the windows and moving outside. So if you're like having a meeting and the weather is nice, it would be safer from a COVID perspective to have it outside. Okay, next slide. Another tool that exists that's important is vaccinations. So it's important to note that vaccinations do not fully prevent infection, but they do reduce the chances of serious illness, hospitalization, and death. So it's really important that if you're able to stay up to date on your vaccines. They are updated regularly, at least yearly, to protect against more current COVID variants. And so if you've only were vaccinated a few years ago, you won't have the same level of protection, both because the variants have changed, but also protection wanes over time. Currently, it seems like the CDC recommendations are going to be that people get a yearly COVID vaccine. That's how it's been for the past few years, where it is updated and released in the fall. Immunocompromised people are eligible and sometimes recommended to get the vaccine more often than that. So last fall, the 2023-2024 vaccine was released. And if you haven't received one, you should get it. A few more things about vaccines. If you need help accessing them, like finding where to get a vaccine, vaccines.gov is a place that can help you find places that are that have the COVID-19 vaccine in your area. And another thing to look up if you are uninsured or you don't have, your insurance doesn't fully cover the vaccine, look into the Bridge Access Program. It should basically, it should cover any payment for, or it should cover vaccines for people who don't have access through their insurance. Okay, and Dean has posted those things into the chat. Thank you, Dean. Next slide. So another important tool that we can use to protect ourselves and each other is testing. So PCR testing, that's where you usually go somewhere where they swab your nose and they send it to a lab, and it's, you know, the most effective type of test. Like, it's way more accurate, but a lot of places don't have it anymore, or it's harder to access. So there are rapid tests that you can take at home, but unfortunately they have a high chance of false negatives. False positives are really rare. So if you see a positive on a rapid test, you're fairly certain that you have COVID. But if you see a negative, it doesn't necessarily mean you don't have COVID. It means, if you have symptoms, you should test again in a day or two. So the best practice is to test at least a couple of times, a few days apart. And basically, again, testing is, a way that you can make sure you aren't spreading it to people in your community if you have COVID, or you can have, people you're meeting with or gathering with test so that you can, keep yourself safe as well. If you need tests, there are some available at covidtest.gov. If you haven't gotten those already, the last ones that were given out were, I think, 4 were given out in November to every household. So if you haven't asked for yours, you should go to there and you can get free tests sent to your house. Another place you should check out is testtotreat.org. they, which I referenced earlier when seeking care, they do give out some free tests to people who are eligible, which I think currently is people who are uninsured or underinsured, that they can send some free tests to your house.
Ocean says in the chat, I wish they provided the multivirus testing kits instead of just COVID.
Yeah, that's a good point. Yeah, there are some tests that in other countries, especially, they have rapid tests that you can test for things like flu, COVID, RSV, and it'll tell you if you're positive or negative for multiple of them. And it is, yeah, definitely unfortunate that we don't have easy access to all of those resources. I think currently on testtotreat.org, though, they are giving out Lucera tests, which do test for flu and COVID at the same time. And those tests are actually more accurate than the regular rapid antigen tests. So if you are able to access those, like if you are eligible for the criteria, it would be good to get those tests because they're accurate and test for multiple things. I think we can go to the next slide. And yeah, again, unfortunately, we don't have access to all of these resources, masks, air purifiers, testing. Like it would be nice if we were all able to have equal and free access to it easily, but that's not currently the case right now. And so I just want to point out a resource where basically there are people in lots of different places who have organized together to, you know, with their own time and money to provide things like masks or tests or renting out air purifiers for free. There are local groups all over the country and the world that provide these resources. If you go to covidactionmap.org, it'll take you to a map and you can see if there's any organizations in your community, if you need help accessing any of these. Hopefully there's someone nearby that can help. And again, I just also want to state like that, you know, none of these things is like going to fully protect you 100% from COVID. I think, you know, people have talked about like a Swiss cheese model of protection, like every single, you know, layer has some holes, like your mask might, you know, might have a hole in it or something that you can still get infected through, or someone tested negative, but it was a false negative, things like that. But the more of these layers that we pile together, the more protection we have. So, you know, it's important to try to use as many of them as you're able to, as that are accessible to you. Next slide. Okay, so now we're just at the takeaways section. So we're coming to a close. I think from this conversation, we can take away that both Mpox and COVID-19 have significantly impacted our communities and continue to do so. I also, you know, want to really impart that like we do have the ability to reduce the spread. So it's really, I feel like a lot of people think, you know, it's inevitable to get infected with COVID or whatever. There's nothing I can do. Everyone's, you know, but the truth is that like these tools do work. And so we really do have an ability to reduce the spread and protect each other as more than, you know, as much as we can. So Next slide. That's all I have in the presentation. If anyone has any questions or comments, we can in the chat. We can try to answer any questions. I want to thank you all for coming. This has been a really good conversation, and I appreciate those who have participated in the chat. And I hope you all have gotten something out of it.
Ocean says, thank you for a quality presentation.
Thank you, Ocean. Thank you for coming.
Christina asks in the chat, are the links shared in the slides available in one location to find?
I don't know if we currently have them, but when this video is posted to YouTube, maybe we can put them with the video notes. I'm not sure if anyone else has an answer to how to have all these resources.
Yes, when this is posted to YouTube, we will include all the links in the description.
We'll just stay here for another minute or two and see if there's any additional questions. Again, thank you so much for coming, and we are happy to answer any other questions or, if you want to share any comments with us. So I think we're going to wrap it up. Thank you so much for attending our webinar. This will be on YouTube in a little bit, so feel free to share it. Yeah, I think that's all I have. Thank you so much, everybody.